Hi, my name is Brittany Equison, and today we will be talking about tuberculosis, a disease that has claimed many lives throughout human history. The history of TB. Tuberculosis is known to be one of the most widespread deadly diseases. It is second only to HIV and AIDS as the greatest killer worldwide. TB has claimed many of its victims throughout much of human history. Signs of TB have been recorded since 2400 BC. It once reached epidemic proportions in North America and Europe during the 18th and 19th centuries. The TB epidemic in Europe was known as the Great White Plague. It started around the 17th century and lasted for 200 years. At that time, death by TB was inevitable. What is tuberculosis? Tuberculosis is a bacterial infection that can spread through the lymph nodes and bloodstream to any organ in your body. TB is caused by the bacteria Mycobacterium tuberculosis, and it most often affects the lungs. TB is spread from person to person through the air when people with lung TB cough, sneeze, or spit. They propel the TB germs into the air. A person needs to inhale only a few of these germs to become infected. Forms of tuberculosis. There are two forms of TB. There is a latent form and an active form. People with the latent form of TB do not show any symptoms, they cannot spread the bacteria, nor do they get sick. The latent form of TB is inactive, thus causing the person to be perfectly okay. However, the latent form of TB can become active. Then the person will go from having latent TB to having active TB disease, which in turn will result with the sick person showing symptoms of tuberculosis and a person capable of spreading the TB bacteria. Symptoms of tuberculosis. Symptoms of TB disease depend on where in the body the TB bacteria are growing. TB disease symptoms may include a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood, weakness or fatigue, weight loss, no appetite, chills, and fever. How TB is detected. The TB skin test is performed by injecting a small amount of fluid called tuberculin into the skin in the lower part of the arm. A person given the tuberculin skin test must return within 48 to 72 hours to have a trained healthcare worker look for a reaction on the arm. The healthcare worker will look for a raised hard area or swelling, and if present, measure its size using a ruler. Redness by itself is not considered part of the reaction. The skin test result depends on the size of the raised hard area or swelling. It also depends on the person's risk of being infected with TB bacteria and the progression to TB disease if infected. Another test that can be performed is the TB blood test. TB blood tests, also called interferon gamma release assays or IGRAs, measure how the immune system reacts to the bacteria that cause TB. An IGRA measures how strong a person's immune system reacts to TB bacteria by testing the person's blood in a laboratory. TB drugs. TB is a treatable and curable disease. Active drug-sensitive TB disease is treated with the standard 6-month course of 4 antimicrobial drugs. There are 10 drugs currently approved by the U.S. FDA for treating TB. Of the approved drugs, the first-line anti-TB agents that form the core of treatment regimens include isoniazid, rifampin, ethambutol, and pyrazinamide. How TB impacts the society. Most TB cases occur in developing countries. However, TB occurs in every part of the world. In 2013, The largest number of new TB cases occurred in the Southeast Asia and Western Pacific regions, accounting for 56% of new cases globally. However, Africa carried the greatest proportion of new cases per population with 280 cases per 100,000 population in 2013. About 2 million people die from TB each year. How HIV and tuberculosis correlate with one another. At least 1/3 of people living with HIV worldwide in 2013 were infected with TB bacteria, although they did not become ill with active TB. People living with HIV are 26 to 31 times more likely to develop active TB disease than people without HIV. HIV and TB form a lethal combination, each speeding the other's progress. In 2013, about 360,000 people died of HIV-associated TB. Approximately 25% of deaths among HIV-positive people are due to TB. In 2013, there were an estimated 1.1 million new cases of TB amongst people who were HIV positive, 78% of whom were living in Africa. How to prevent TB. These are 3 ways of how to keep TB contained. Do not spend long periods of time in stuffy, enclosed rooms with anyone who has active TB until that person has been treated for at least 2 weeks. Use protective measures such as face masks if you work in a facility that cares for people who have untreated TB. If you live with someone who has active TB, help and encourage the person to follow treatment instructions. And that's all I have for you guys. Thank you.